We know that there's a culture of fear which is within the system, whereby, part of it is actually due to the top brass in MOH. We are not talking about a specific person or persons and all that, but we know that some seniors within the Ministry of Health, they whenever certain officers speak out against the system, they have been reprimanded, right? So this is something which we really need to look at, and you must understand, junior doctors are also vulnerable because when they are facing with all these senior people, they always feel that if they take the wrong step and complain against the wrong person, and you must understand this is not only about the HOs, but even the medical officers, even the consultants, right? So this system is there whereby they fear being reprimanded for going against the system, and I think that that ought to change. But MMA is cognizant of this thing which is going on in the Ministry of Health, and the Ministry of Health officials are also aware of it, and we have been having regular dialogues with them as to how to overcome this. And I would like to say that at least a lot of things which are being brought up by MMA regarding this is being recognized by KKM itself, and we are still having ongoing dialogues. Are reforms really needed in the training of house officers? Everyone is looking at incidences of bullying in the healthcare sector, particularly among the junior doctors. We need to define what is bullying. From what I've been reading in the media reports, bullying can mean anything from the use of harsh words or foul language to being asked to do an errand by someone who is more senior. My concern is that even instructions related to work, if deemed unacceptable to a junior doctor, it can even be construed as being bullied, which is really unfair. If there is outright bullying, where there is an obvious misuse of power that is repeatedly done with an effort to create physical, social, or even mental harm, MMA will not condone it. Such abuse, whether physical or social in nature, has no place in our healthcare system, be it affecting the junior or the senior doctors as well. It has to be reported and action taken to prevent a continuation of such incidences. MMA will assist any medical doctor, not only juniors, who comes up to us for help, especially if it involves bullying. However, are we to look at bullying itself and say that we need to put a stop to it and initiate measures to punish those who bully? This would be simplicity by itself. It's not that simple. What is the real cause of bullying? We need to look at the whole makeup of the healthcare fraternity and understand the reason as to why there is a high level of stress among the medical doctors, especially in recent years. High-handedness and bullying has been there all this while, not only in the public healthcare institutions, but anywhere which employs the system of defining juniors and seniors, even including your own, your company and the media setup which you work for. I'm sure you have encountered such incidences before. MMA had recognized that such incidences has been increasing when there was an increase in the number of medical graduates, and we had raised our concerns with the Ministry of Health some time back. The Ministry of Health had set up a system whereby there were senior clinicians who were given the task of looking after the welfare of the trainee doctors, and had also put in place a system whereby trainee doctors could bring up grouses and complaints which will then be looked into. However, this will only be effective if every department is to employ this system, and if employed to ensure that there is no fear or favour to the handling of such issues. Only problem is certain hospitals, it's been labelled as so-called flagship hospitals. They do not employ the system. Even though the system is there, they do not take measures to ensure that the grouses are looked into. And it's not coming from me, it's coming from Ministry of Health itself. Recognizing the fact that cases of bullying may never be reported for fear of being singled out for further punishment, MMA itself had launched a helpline in the year 2016 called Help Doc, where assistance will be given to doctors who call the helpline. This was done in the belief that with the case being looked into by MMA, which is not related to Ministry of Health, there will be justice done without the fear of being reprimanded. Trainee doctors will need to understand, however, that the training as a medical doctor will only begin upon graduating from medical school. The houseman training period is when they will be honed as competent doctors. The more they are exposed to, the more experience they will be able to obtain in order to serve them well when they are finally registered as a medical practitioner. They need to have the experience during the training period. And one should not take the differences between generations as an excuse to say that what works for a previous generation will not work for a younger generation. I just would like to remind everyone that patient care has never changed throughout the generations. And hopefully it never will. Or it will relegate the doctors to just mechanical robots with no heart at all.
Or is it like too sensitive?
No, not really. I guess